This is World Now. This week marks World Breastfeeding Week 2025 with a global theme, Prioritize Breastfeeding, Create Sustainable Support Systems. The campaign highlights the need for stronger long-term structures that support mothers and empower families. Coordinated by WABA, WHO, and UNICEF, the initiative celebrates breastfeeding as a child's right and a public health priority. This year's message aligns with the WHO's wider campaign, Healthy Beginnings, Helpful Futures. Sri Lanka has been recognized as a global leader in breastfeeding success, with 90% of mothers initiating breastfeeding within the first hour of birth and 82% exclusively breastfeeding for 6 months. With robust policies, hospital support systems, and strong partnerships with WHO Sri Lanka, the country is setting the standard for sustainable breastfeeding practices, proving what is possible with leadership, investment, and cross-sector collaboration. Social Policy Manager, Officer in Charge, UNICEF Lagos Field Office, Mohammed Okori joins me live for more. Good to have you on World Now. Well, let's explore the theme of this year's commemoration, Prioritize Breastfeeding, Create Sustainable Support Systems. What's its significance?
Thank you very much, and good evening, viewers. The significance is it goes to underscore the need for a collective effort to ensure that breastfeeding is not just that biological exercise that the mother does, but a holistic approach where the society, everybody, supports that mother to breastfeed. From the family, from the husband, to the community, to the society, to the religious institutions, and most importantly, to the government, to establish a functional system with a framework that supports the mother to breastfeed. So this time around, we are looking at it more holistically, and we're looking at it from a more sustainable angle. And that's why the theme of this year, it's not a fragmented effort, but a coordinated effort that ensures that henceforth, this will be entrenched in our system, both at community and at global level.
And the WHO has described breastfeeding as a child's right and a public health priority. Talk to us about that.
Yes. First of all, I think, like I said earlier on, that's the first vaccine that a child takes. Breast milk, incidentally, is loaded with all the water that a child would need within the first 6 months, with also the nutrients that a child will need within the first 6 months. And even the colostrum that comes out within the first hour of birth is also loaded with vaccines, which a child needs, not just for immediate survival, but also for effective brain development that enables that child to contribute effectively to nation building in the future. So at this stage, this is a right of the child, not a privilege, and every institution who we refer to as duty bearers must ensure that they play their roles to ensure that the mother is supported to provide this right to a child, which is the first right a child gets before all other rights. So for us, after birth, the first right that a child needs is that right to breastfeeding, and it has to be given. And that's also why you've seen that this year we are prioritizing an institutional framework that guarantees the realization of this right of the child.
As it is, Sri Lanka is being recognized as a global leader in breastfeeding success. Where does Nigeria stand, and how do we climb up the chart?
Well, one could see that Nigeria, up to 90% of mothers have initiated breastfeeding at some point. But when it gets to early initiation, that's where we have challenge. We're having about 57%. Then when it also comes to exclusive breastfeeding, Nigeria is also way back. Because if you look at it, 1 in every 3 child is exclusively breastfed, which is a very big challenge. So right now, it shows that the institution recognizes breastfeeding, but other factors have prevented the child from benefiting from that early initiation, as well as completion of first 6 months uninterrupted breastfeeding without mixture of any sort, and then from 6 months, introduction of other complementary feeding options for up to 2 years for the child. So Nigeria hasn't gotten to that level where Sri Lanka is. And that's why we're looking at a holistic approach to achieving that, right?
Mr. Corey, now I was going to say that we are in Nigeria, and especially we are both in Lagos, where we know what the hustle looks like, where people have to step out of their homes as early as possible, trying to, get their daily bread. What would be your counsel, your advocacy to mothers, communities, companies, government about making this happen?
Thank you. Now, this is the holistic approach we said. One, the support starts from home, where every member of the family, especially the husband, supports. The social norms that support exclusive breastfeeding has to also be systematically entrenched within the communities. But when it now comes, especially like Lagos, like you mentioned, women face numerous challenges, some of which is the fact that their absence of paid maternity leaves. So women are forced to go to work before their child is even strong, where they have that convenience. Most of the offices also lack breastfeeding rooms and convenient spaces where they can. Some women also who work find it difficult to find a dignified areas where they can breastfeed their babies, and sometimes also face challenges with their bosses who feel that they take so much time in trying to find spaces to breastfeed their children. So to this extent, there is a need for a policy framework that guarantees that a mother is given 6 months paid maternity leave. That puts her mind at rest. And even when she comes back to work, there has to be a space guaranteed for the mother and the time for the mother to go to constantly breastfeed. Remembering that we're saying exclusive breastfeeding for the first 6 months, which means there's no introduction of water or anything. It has to be breast milk and breast milk alone. Now, this call also goes because within Lagos, you also see the informal sector, the marketplaces. We don't have all these facilities there. So there has to be a strong policy framework by government and by all stakeholders to ensure that there is a dignified approach to encouraging women and sustaining that. And also there is need, and thank you very much, TVC, also for playing this role, because there needs to be a concerted effort in terms of demystifying all issues around breastfeeding, especially the Gen Zs, as we call them, who think that, oh, breastfeeding is old-fashioned. They need to know the importance of the breast milk to the child, to the family, and the nation at large, and the fact that it has no consequences to the mother at all. So it's a concerted effort that all we have to do to put those measures in place.
Okay, thank you very much. Social Policy Manager, Officer in Charge, UNICEF Lagos Field Office, Mohammed Okorie, thank you very much for your time on World Now.
Thank you very much. My pleasure.
Well, let's